Hello, everybody, and welcome. I am Dr. Dan Kalish, and we are here today to speak for our free webinar on our longevity mini series. What does that even mean? It means that we have a longevity certification training program now, a one-year class that I've spent 14 years building. So it's been a long time coming to build this course out. And this free webinar is to introduce you to what the longevity certification is even about, give you a little example of some of the lectures that you would encounter if you sign up for that class, and we'll look at a case and I'll build out a protocol. And if you learn something from the lecture portion, you learn something from watching me build out a protocol, then it might be something that you'd want to take. And we have today as the focus, muscle as medicine. Muscle as medicine. Food is medicine, we've all heard that one. But there was a period in my career for about 8 or 9 years where I had a group of professional athlete trainer people that I worked with. There's like 6,000 of them throughout the world, and I was teaching their nutrition courses. And a large percentage of my referrals in those days were, pretty high level athletes, either professional athletes or people who had a lot of money and like to work out a lot, with those the two groups. But either way, there were people who were in very physically good condition. And what I learned during those years of practice, when I compared those people with my chronically ill patients, was that if you're well muscled and your VO2 max is really pretty good, you can get away with a lot of other, let's say, lifestyle indiscretions. And the opposite is true too. If you don't have great muscle mass and you don't have a pretty decent cardiorespiratory system, your lungs don't, your heart don't work that well, then even the most pristine diet in the world is not going to save you from a chronic illness problem. So, I learned the hard way that, and this was my old joke I used to have with patients, is food is the most important thing. We're going to work on your diet, but exercise is more important than food. And I think generally exercise has to come second. We want to clean up people's diets first and really get that hammered and get that sorted out. But then if you don't do the exercise part, you're not really doing your job. Okay. So this is me. For those of you, this is the first one of these you may have taken. I've been in practice forever, since the early 90s. I don't even want to put in length of time on it anymore. I've trained thousands and thousands of practitioners. I talk to hundreds and hundreds of doctors every year. And our goal at the Kalish Institute is to get you all up and to speed and get your practices built with lab interpretation skills, patient communication skills. We want to get you at the cutting edge of the work that we're doing here in functional medicine. I've worked personally with Richard Lord, who was the original scientist that designed organic acids, fatty acids, amino acid testing. His lab was the one that cranked all this stuff out back in the 80s and 90s. And he's the one I spent 14 years studying with to put together the longevity class. So I would give Richard Lord credit for like 80% of the course that I'm teaching now. And all the years that he spent training me, I am trying to pass on to you all. And that's why he spent all those years training me, because he knew that I would get out there and create courses like this for the next generation of practitioners. So the longevity certification, there's a new group starting right now, like today, May 27th. If you want to sign up, you can still sign up. We have a couple of spots open, so go for it. And you can either take it as a year-long course, or you can just sign up for the first section and just do that and then see if you like it and then do other sections later, okay? And here are the 4 different sections. We're starting microbiome and brain now. And for those of you that are in the mentorship class or have taken my mentorship in the past, this is pretty much all new material, okay? So if you've done some of these other courses, this is gonna be a refresh or a completely fresh version of it. Then we're going to get into later in the year toxins, hormones, immune, and then early next year we'll be doing the cardiometabolic part of this. So it's a 4-part year-long course. You can take one part at a time. You can take the entire series, and of course you get a discount if you sign up for the whole thing. And you can scan these QR codes if you're interested in either taking the whole year-long class. It's massively underpriced, by the way. We have it for a very low price this year. I don't know what we're going to do next year because it's a huge amount of content in here. So again, you can sign up for just one section, or you can go for the whole thing. The whole thing is microbiome, brain, toxins, hormones, genomics, and cardiometabolic. That's the whole year. And the portion of the class that's coming up right now is just the microbiome and brain part. Okay. And we have codes and more QR codes here than you could figure out. You're going to get all this emailed to you, so don't worry if I'm going too fast with the slides, but you can choose either to sign up for the whole year, or you can sign up for just the microbiome and brain part, okay? So what's the goal here? What is the real goal? Oh, and by the way, I should tell you the structure. So I'm going to go through these slides relatively quickly so we have time to then review a case, and I'll build out a case so you can see how that would work. And then at the end, we'll have time for questions. So if you do have questions, type them in. Happy to answer them. The goal of the class really is to see if this is something you even want to do with your life. Do you want to take a year out of your life and really learn how to interpret labs so you can make like state-of-the-art individualized longevity plans for all your patients so everyone that you work with can be really healthy and not die of cancer, heart disease, or a neurodegenerative disorder prematurely? Is that something that you want or not? When I think about the longevity field, what the heck do you think they built functional medicine for? I mean, we own this space. We are the longevity people. We're the whole, I mean, this is like conceptualized in the 1960s. Give me a break. Like that was the whole idea, was we wanted to find problems in people's health before there was a disease. That's why it was functional medicine, because it was finding organ dysfunction prior to the onset of disease. And functional medicine is not early detection. That's a whole different problem. Early detection of cancer or diabetes or heart disease, there's a disease that's already there. You're just finding it sooner. That's not what we do. We're like one step before early detection. That's the whole conceptual framework of functional medicine as it was developed from the 1960s through the 1990s. Not to define diseases early, not to wait until there was the early warning sign of heart disease, but to find diseases before that even happens. And all of that starts with the muscle. Nowhere more in your body does that start than in the muscle tissue, because your muscle tissue is primarily a metabolic and endocrine organ. That's what it's doing. That's its main role. It's a metabolic. Okay, yeah, it moves you around. Yeah, that's kind of convenient. That's like a complete side benefit. That is a complete side benefit, okay? It's the metabolic and the endocrine organ that's influencing all the things that screw people up. Glucose regulation, or you could call it insulin resistance, that starts with muscle problems. Inflammation, obviously, if you've got too much body fat and not enough muscle, you're going to be inflamed. Just the fat cells alone are going to cause you to be inflamed. And if you don't have the muscle mass that you need, you're going to be aging at a greater than normal rate, far greater than normal, what should be a normal rate. So we want to figure out, like, how can we dial in an assessment of the first early warning signs of muscle loss? Okay, not when there's sarcopenia, we're talking about way before that time. And then how does that relate to catabolic physiology and the somewhat inevitable decline of hormones? You know, and most people that we're working with have massive amounts of catabolic physiology, meaning they're breaking their tissues down excessively. And so that whole hormonal decline that's normal with aging is just being accelerated hugely. And we can find all this out with lab testing. This is what functional medicine was developed for. You know, functional medicine was developed for early detection of problems before diseases, but it got used from the 90s onward as a way to deal with chronic illness, which is great. I was thinking about it today. That it's a noble cause. I'm not against you guys treating chronic illness at all, not even a little bit. But why don't we find these people before that even happens? That's really what this whole class is about. This whole year is about. Is like early detection, even before the chronic illness parts, let alone a conventionally diagnosed medical disorder. So skeletal muscle regulates glucose uptake, it regulates glucose utilization, and you have to have enough of the muscle tissue around for your insulin to work properly. Okay, as soon as the muscle tissue levels start to drop, you're going to have some problems. You're going to have inflammation just as a result of having not enough muscle tissue. You're going to have a lack of mitochondria just as a side effect of not having enough muscle tissue. And then there goes your oxidative stress, there go all these other factors, right, start to accumulate, and then you're just a metabolic crisis walking around, okay? And if you don't change the muscle mass and you don't change the cardiorespiratory capacity of the individual, you're really not helping. The supplements and the diet just are not enough. They're just the setup. The supplements and the diet are just the setup so the person can get out there and start to do the physical exercise that they need. Now, if the person's sarcopenic, then we're like 30 years too late. But that's kind of how this general category of health is usually looked at as, so this advanced muscle loss. We don't even want to go there. But when you look at the curves, this is maybe just to scare people a little bit more than anything. If you have a new patient, you need to scare them a little bit. Like, if you're active, you're in the green. So here we are at birth. We grow, we get stronger, we get stronger, we grow, we get stronger. Okay, now we're at 30 years of age. That's as good as it's going to get. So then the question is, do you want to gradually decrease your strength and capacity and muscle mass like the green line up there? Or do you want to fall off a cliff like the red line? That's what we're trying to do. We're not saying that you can completely stop this process, but look, the green line shows you can really stretch this stuff out. And you can, even at the end of your life, even at age 90, you can be somewhere around where the red group here is going to be in their 50s or 60s. Okay. So in other words, you can be a 90-year-old. And I know this, like my mom lives at this place called Cardinal Point, and I go to visit her all the time, like a couple times a month. And most of my mom's friends, she's 87, most of my mom's friends are over 90. And there's like 6 or 8 of them that are 100 or plus. So I see these people all the time. And you can tell, you look at this, there's this one guy, I can't remember his name, it's like Charles or something. He was a crew, he rode crew at the University of Washington in like 1942, okay, like during World War II. This guy was on a crew team. If you've ever seen this movie, Boys in the Boat, he was like one of those guys, okay? And he's walking around, he's like, I don't know, 90 something now. This guy is just like ridiculously fit, okay? And he looks like your typical 60-year-old. You can just tell. I mean, I've never seen him work out, but you can just tell based on his posture, how he's sitting, he's got the muscle mass, he's got, that can happen. You can do that. And you don't have to be like a boy on the boat and, be in the best crew team in the world, 1942. You can start the working out now. In fact, there's a lot of research now that shows that even if you start kind of late in life, you can still build up muscle mass and still have all these benefits of muscle, even if you're not a lifelong exerciser. It's a super common problem, just the prevalence of this. It's going to happen unless you prevent it from happening. Maybe that's the way to think about it. You're going to start to lose muscle a couple percent a year once you're at my age. I just turned 60. I mean, it's just happening. At 30, as you can see, you're already engaged, but 50, 60, it's kind of accelerating just a little bit. And then if you have less activity because you don't feel like exercising because you haven't exercised in so long, it just kind of gets worse and worse and worse. And then that's really not the biggest problem. The biggest problem is that then you have an increase in inflammation because as soon as you put on the body fat and the muscle mass goes down, those fat cells are just cranking out all kinds of inflammatory things throughout your body. You become insulin resistant because when you eat a meal, 80% of the glucose that you just consumed gets put into muscle tissue. So if you don't have the muscle tissue, you're insulin resistant right off the bat. There's nowhere else for that glucose to go. 20% is supposed to go to your liver, 80% to your muscle. If you don't have the muscle there, it's going to be a problem. And then, of course, mitochondrial dysfunction because the numbers of mitochondria in the muscle tissue. Now everything gets more and more catabolic, and then all of a sudden you're, not in a good place physically. And it's a very measurable, understandable process, this kind of inevitable decline, but we just want to prevent it from happening. You don't want to get those skinny, frail legs. Okay. Chronic inflammation causes it, chronic stress causes it. And then we're going to look at some nutrients now too, and just think about the things that you need to be testing for and the things that you need to be tracking. Obvious stuff like vitamin D, calcium, zinc, the things that you need to build bone. Obviously, you just need to either give them a bone building formula or test those levels if you know how to do that. And then I want to get much more for the rest of the class into like what I think of the fun and really incredibly useful types of tests. And that's going to be amino acids, because we use amino acids to build muscle tissue, obviously. And there's some that are really important, extra important. They're the branched chains, I'm sure you've all heard of. The most important of those is this one called leucine, but all 20 of the amino acids that we need to survive, to make proteins, are really, really important for this. So amino acid testing comes into play. Cortisol testing comes into play because if your cortisol levels are off, you're by definition catabolic. That means you have an accelerated breakdown of tissue, which includes obviously muscle. So you can play it from either side. You can have not enough amino acids to build up. You can have too much stress on the adrenal side with cortisol, which means you're breaking down excessively. And a lot of the people that we're working with have both. Their cortisol levels are off, so they need to test and correct their adrenals because they're catabolic, meaning they're breaking tissue down, and they don't have enough amino acids to become anabolic to build up. And those two things together are really going to be a bad combination. All right, for those of you that joined us late, we have this certification training program. 14 years of my life went into this. These are the lectures I'm extremely proud of having been able to do. It's an amalgamation of Richard Lord's work, and it's different sections. We're starting the first section today, actually, which is gut-brain. And then later in the year, we're going to have toxins, hormones, and cardiometabolic early next year. So there's all kinds of different QR codes here. You can get discounts off if you use these, if you listen to this lecture. We'll be sending these out via email, so you guys are going to get copies of these. And you can either sign up for the whole year, which makes sense if you really want to make this work for your whole practice, or if that's a little too much, you can just sign up for the individual single brain gut one that's coming up starting today, okay? You have a whole bunch of options there, and we'll send you out those codes. So here's the heart of the whole matter, is that we're looking at anabolic versus catabolic physiology. Cortisol is catabolic. That's promoting the breakdown of tissues and organs. That's not good or bad. That's not good or bad. It also, frees up fatty acids for energy. But it's just if you're overly catabolic that it's problematic. Then insulin is an anabolic hormone, obviously, and it's promoting the uptake of glucose. So cortisol is promoting the breaking down. Insulin is promoting the building up. And insulin's not good or bad either. It's just that if you have too much insulin for too long because you're eating too many carbohydrates and you're getting too much sugar in your system, then you get too much building up, and that all of a sudden now you have a lot of body fat, and it's going to get ugly, right? So excess cortisol triggers excess muscle loss. Cortisol by itself is fine, but when it's to the excess, it's a problem. And then excess insulin resistance, that starts to interfere with muscle growth. So neither of these hormones is good or bad. It's just that if cortisol is too high and if you're insulin resistant, then you're going to have this double problem, right, from both angles. And so we want to be able to understand, we can actually test for all this. I mean, that's the cool part. You can test cortisol and see if it's all wacky, then you know that they're overly catabolic. And you can test for insulin resistance. You can even test for the precursors to insulin resistance, which is related to things like pyruvate and lactate, and see if there's even a pre-step that's happening with insulin resistance before it actually shows up with the glucose and triglycerides and insulin levels being off. And then you can dial in their anabolic catabolic physiology so that they can start to build up. And then the exercise that we want people to do further helps this process. So if you know the state of their adrenal hormone levels, then you can give them an appropriate exercise program. If they have low levels of cortisol, you don't want them doing types of exercise that really stress your cortisol bad, like training for a marathon. That would not be good for someone with really low cortisol because they've already exhausted their adrenal glands, and lots of cardio, like training for a marathon, is going to make that person even worse. You want that person to be more anabolic. You want the exercise to promote them building up their tissue, not breaking it down. And exercise programs can be completely customized based on what the functional medicine lab work says. Another classic example is they have a fatty acid oxidation problem. Maybe they don't break down fat very well for fuel. And you see that these carnitine markers on the lab are far, out of range. Adipate, suberate, ethylmalonate, there's a whole bunch of these markers that can show, if they're high, that the person's not breaking down fat very well. So that person, their exercise program would be what? Something that improves your mitochondrial capacity to oxidize fat. That's called zone 2 exercise. If you don't know what that means, you should look it up later. That's pretty important. Zone 2 exercise is kind of a lower intensity cardiovascular exercise that we know through gazillions of research studies has been looked at for a very long time. We know that zone 2 improves mitochondrial efficiency in terms of burning fat. So you give the person some carnitine and then you prescribe zone 2 exercise together, and that combination is just like life-changing. Super low cortisol, you give the person some pregnenolone and anabolic or building up exercises, and then boom, a few months later, their lights are turning on. Now, of course, everybody ultimately you want to have doing both strength training and cardio, zone 2 and zone 5, and all kinds of different strength training routines. So they're building muscle. But in the beginning, when you're just getting people started, the lab work can guide you so you can see what's going to be the most effective exercise program for this person right now that's really going to make them feel better as you build up. So if you give, like if you took your carnitine deficiency person and you gave them a ton of really hard cardio and a ton of strength training, it's not going to help that much. I mean, help a little bit, but you could way change their body faster, like 10 times faster, if you do the right combinations of exercise, diet, and supplements based on the lab. And with the ultimate goal that you're getting everybody to be able to do zone 2 and zone 5 exercise along with strength training. I mean, that's the ultimate goal. That's what we're building towards. But if you can look at their insulin levels, their cortisol levels, their amino acid levels, and you can get a much better sense of how to push that along. So 4 horsemen of accelerated aging, I've been using this model for a couple decades. I kind of like it, but you can make up a different term or even have a different set of bad things that happen. But to me, these are like the key bad things that really make us age. Inflammation, insulin resistance, oxidative stress, and muscle catabolism, which is the same thing as catabolic physiology. That's the stress response, right? When we're breaking tissue down. And if you can stop the inflammation, reverse the insulin resistance, give them enough antioxidants that the oxidative stress goes away, and stop the muscle breakdown that's excessive, then you're flipping the person around and being able to really help. And then these are just some articles. I don't want to really spend a lot of time on it because I want to be able to do a case, but just so you can see, people have looked at this for a while. The role of inflammation in muscle loss, the role of insulin resistance in sarcopenia, the role of oxidative stress. I don't know where my study is, but there's one on that somewhere in there. And then all of these things built together, we need to then look at an integrated program, right, to deal with the insulin resistance, oxidative stress, catabolic physiology, and inflammation. We want to address not just the muscles, but your cardiometabolic system and your brain and your detox pathways and your GI. And in functional medicine, we blame almost everything, at least in the beginning, on GI. And so we see the GI as like the center place for chronic inflammation developing in the first place. That's going to affect the rest of the tissues. And I think at the same time, you can also think of GI problems, especially malabsorption, not being able to break down protein, as a contributing factor to muscle loss. And so if your gut is inflamed, you're going to make a lot of cortisol. It makes you catabolic. Now you're breaking down muscle. If your gut can't absorb because it's inflamed, now you don't have enough amino acids coming into your bloodstream. So now we have an inflamed person with high cortisol who's got accelerated muscle breakdown simply because they're catabolic. And they don't have enough amino acids to build anyways because their gut's not working very well. So that's kind of like the classic, you're kind of in a little bit of pickle here, aren't you, kind of problem. So what do? You fix the cortisol levels, you bring down the catabolic physiology, you fix the gut so they can start to absorb nutrients, and now you got somebody who can get out there and exercise. I've done this with so many athletes. I wish someday I want to sit down and just write a book about all the patient stories because there's so many good ones. But I had this one guy, he was the #1 natural bodybuilder champion in, I don't know if it was the world or the United States, but we did this whole complicated program and his deadlift improved by 5 pounds. And I was like, okay, is that good? And he was like, oh yeah, are you kidding, Kalish? Like this is like career changing. And I'm like, okay, that's cool. I had this professional golfer once, and she couldn't hold her golf club without shaking everywhere, and she wasn't having a very good season. Like she couldn't hit the ball because she would just shake all the time. As soon as we fixed these basic things, just her gut and her amino acids and her cortisol, she's like swinging away at the golf club, and she's back on the women's PGA tour. I don't know what the name of that thing is, but she's back playing professional golf. It took like 6 or 8 weeks to get her to play golf again. So you can totally do this. This is like, as we say in our family, low hanging fruit, okay? This is not a complicated, really difficult thing to put together, not even a little bit. We talked a lot about stress already. That's a big component because stress is a driver of catabolic physiology. So you got to be able to test and correct the adrenal glands and deal with, all these things to do with blood sugar are super important. But I think the main part for today's talk, because it's not an adrenal talk, is really that muscles are the storage area for glucose. Muscles are the storage area for glucose. So if you're losing muscle mass just by getting older, you're losing your major reservoir for glucose. So when you go out and eat a whole bunch of sugar or drink a Coca-Cola, eat an ice cream thing, if you don't have the muscle mass to buffer all of that glucose that's hitting your bloodstream because you don't have enough muscle, you have now the beginnings and the development of insulin resistance just because of your muscle tissue screwed up. That's it. Now, having good quality muscle tissue implies that there's a lot of other things going on in your life that are good. You're probably not smoking cigarettes and you're probably not drinking too much alcohol and all that. But I'm telling you that period of my career where I worked with these athletes, you'd be amazed how much, if you have really good muscle tissue, how much you can totally eat crappy quality food and get away with it. But it doesn't work in the other direction. So in other words, if you're eating super clean food, like literally you have your own organic garden that you grow stuff, and then your friend Barry down the street kills like deer and has cows, so you're getting all your meat fresh off the farm. If you're doing all that stuff and you don't have the muscle tissue, I'm telling you, it's just not going to work. You're not going to be a healthy person. So, and you can obviously do both. There's no reason why you can't just eat healthy food and exercise, but the exercise component, I think in our functional medicine is kind of, I don't know, it started in the 90s, and weren't we all kind of hippies a little bit? It was a little bit organic food, health food store kind of people. And it was, honestly, like in those first early seminars that I went to, 1992, I mean, there may be a couple of people in there that were really ridiculously physically fit, but not that many. Most of them were kind of like me, kind of scrawny, kind of like, oh, I'm doing yoga, oh, I'm having wheatgrass juice, you know. And so I don't think functional medicine's roots are in the gym, basically, because most of the people that created this field are not ridiculously physically fit. They're just not. And so it's something that we've got to introduce. We got to bring this in. It's just like we got to step up our game. We got to add this. All of us do. You got to be in the gym 3 times a week. I am. You know, you have to be. It's not an optional thing. No matter how bad I feel, how tired I am, how cranky I am, whatever happened that day, I never miss my workouts. It's just not an option. We have to be at that level ourselves physically, and then we have to extrapolate that out so that our patients can believe it. Because if you can't deadlift your body weight and squat, 100, 200 pounds, I don't know how big you all are, but whatever, you need to be able to squat, and you can't bench press 130, 150, 200 pounds. Again, I don't know how big each person out in the audience is, but if you can't bench press a decent amount, squat a decent amount, and deadlift a decent amount, then patients just aren't going to take you seriously. Okay, and just to give you a reference point, I'm 60 years old. I'm like 5'8" on a good day, and my deadlifts right now are at 200, which I was surprised that I could get that high, to be honest. My squats are not that great. I don't know what he has me doing. Like my trainer has me doing like 130 on squats. I can do bench press 135 all day long now, you know, not all day, but I can do 3 sets of like 8, I think, at 135. So it's not huge. I'm not like a huge guy, but it's reasonably strong. It's not embarrassing to be in the gym working out. For a 60-year-old guy, I'm kind of hanging in there. And so you don't have to be like the Hulk. We're not what we're talking about here, but you got to maintain a minimal thread of muscle mass in order for these things to be, in order for you to be healthy, basically. Okay, again, so muscle is the largest metabolic organ. We talked about that. So let's get a little bit into the interventions, and we're going to look at a case in just a minute. So branched chain amino acids are really important. There's one in particular called leucine that's extra important because certain amounts of leucine, it's around 2.5 grams, are going to stimulate muscle protein synthesis. They're going to stimulate muscle protein synthesis and inhibit muscle degradation. So that ends up being a little extra important. That's your counter effect to a catabolic state. You see that? It's like a little switch you're flipping. Take these branched chain amino acids. How much? Well, at least 2.5 grams of leucine plus whatever else is going to be in there, right? And that's whoosh, going to flip a switch. And now all of a sudden you're in an anabolic state. You're flipping the switch there. Then it's not going to help if they're not also exercising. So you can't just take the branched chains and then sit around. Okay. And every company that we work with will have a branched chain amino acid formula. They're always in a powder because it's too many pills. You wouldn't want to take that many pills. And it's like a scoop of these powders, twice a day. Some of them have that extra amount of leucine, some don't. So you kind of have to look at that and figure that out. But it's not a difficult thing to do. And you can get branched chain amino acid powders from just about every company. And I strongly suggest that you test amino acid levels before you do any of this, because the amount of amino acids and which amino acids you're going to give to somebody is going to vary depending on their lab work. So there's some generic recommendations, certain amount of branched chains plus the 2.5 on the leucine plus some amount of creatine or whatever that are just generic that you can just give to people. But the whole point of functional medicine is biochemical individuality and personalized programs. So if a person's low in lysine, let's say, and that's not really on your radar screen for muscle growth and muscle building, but they're low in lysine, they're not going to build muscle if they don't have all 20 amino acids. You need all 20 amino acids for protein synthesis. So there's some that are extra important, but the testing will show you which are the ones that that person's actually low in. And here's what I was thinking when I made this slide. You should just take a picture of this because this is like a 2-hour talk, just this one slide. But I just wanted to get out there like all the different variables to consider with exercise. HPA axis, protein synthesis capacity, past history of exercise, current level of fitness, short-term goals, long-term goals, muscle growth, VO2 max improvement. This is a long list here. Oxidative load, glutathione status. But these are all the things that you kind of have to put together into an integrated program. It's a lot, but you can't really look at it any other way because it's an integrated system. These systems are all overlapping. And I can point out the ones that get missed the most. So you guys, if you guys don't know these cold, what are you going to do? You're going to sign up for my longevity class, right? So everybody knows about the adrenals, but protein synthesis capacity, that means you have to know how to test amino acids. And you have to get all 20 amino acids dialed in because you need 20 of these amino acids to make muscle. If you don't have all 20, it's not going to happen. So people miss that a lot. The other one that's missed most of the time, I think, is beta oxidation. And long chain fatty acid oxidation disorders, long chain fatty acid that gets missed a lot. You'll see that on organic acids, okay? These others, I think most of us are pretty aware of in general. You wouldn't think that glutathione matters, but it does because you really can't do anything without glutathione. Okay, so these are the different variables we want to take. So the idea being that we have this broad look at what we're trying to do here and that we have an intention with the program to push the patient to a certain place. I just give you like a simple example, like in my case. So I've been with the same trainer for the last couple of years now, this guy named Nick, and pretty consistent improvements in muscle growth. Like I got up to, like the 135 with the bench press, 3 sets, 8 reps. I got up to 200 pounds, my deadlift, like woohoo, woohoo. And then what did I do? I started running and biking a lot. And I went into the gym once, I don't know, it's like 6 months or a year ago. And I completely failed. And because we're doing this progressive exercise program, progressive loading and time under tension and all the stuff he's always rattling on about. And I was, I failed. I just like literally failed. Like I fell down on the floor because I couldn't do enough of the squat things, And he's looking at me going, okay, Dan, what's going on? He thought, are you drinking? That's the first thing he said. I said, are you drinking alcohol? I was like, no, I haven't had a drink in a couple of years. And then, and then he looked at me like he was suspicious. He was going, you can see him going through his mental, like personal trainer list of how this guy's screwing up his life, sleep, drinking. And I was like, well, and then I confessed, well, I've been riding my bike every day for like an hour, hour and a half. And he just got so frustrated. He was like, are you serious? So, it turns out that if you want to because I was getting into this whole VO2 max thing and I really wanted to get it turns out that if you get your VO2 max really improved and you start to ride your bike every day for an hour and a half, it's going to make it harder to get your muscles to grow in the gym. I learned that one the hard way. And so Nick he kind of forced me to see, he's like, that's just too much. You're not gonna be able to grow muscle if you're doing 2 hours every day on the bike. And he's like, is that really what you want to do? I was like, not really. I mean, so anyways, we negotiated down. I get 2 long bike rides a week now, and then I can ride my bike for like a half an hour whenever I want. But you got to coordinate all these things together. It's kind of complicated, more than you would think. So this is a shout out for you have to have a personal trainer or someone with a lot of exercise training experience to help you. Um, I would never consider designing one of these full-on exercise programs by myself, except for the obvious things. Like, I'll go through the obvious things when we look at the lab, okay? And then here are the basic products you should be familiar with: amino acid powders, B vitamins, obviously, so you can use the amino acids. Glycine and leucine are extra important, and then collagen helps people to a certain extent, and creatine helps people quite a bit. Okay, so longevity certification is coming up. You can take the whole year-long class. You can take just one module at a time. And let's look at case studies for a sec. I pulled up one here. I thought this was kind of cool. This is a random one that I just happened to find. And we want to look at the husband. It just happened that the husband and wife tested side by side, which I thought was kind of cute. You can see how different people are, really. So this is a GI map test from Diagnostic Solutions. And the husband, as you can see, has a little hint of giardia. You see that right there? Not a lot, but a little bit. And with giardia, even a little bit's maybe not something you want to be walking around with. And we're thinking about muscle mass for this guy, okay? Oh, and then look, he has H. pylori. Well, that's interesting. A little bit of an infection in the stomach. A little bit of dysbiosis. I'm just looking at the husband's labs here. And then some enzyme problems, and SIG-A is low. So SIG-A being low is an indicator of something wrong with cortisol. So now we kind of know he's catabolic. He's got H. pylori and a little bit of giardia. So now H. pylori is an infection of your stomach. And when you have H. pylori, it's going to interfere with protein digestion because it interferes with stomach acid production. And so even if you're eating adequate amounts of protein, it's not going to be absorbed fully. You will oftentimes see, not always, but more often than not, H. pylori infections in people who have low amino acid levels, assuming they're eating the right amount of protein. So a patient comes in, they're eating the right amount of protein, but they can't build muscle. They don't know what's wrong. They think maybe their workouts are being screwed up in some way. And it turns out that they have H. pylori and they're just not breaking down protein very well. They're just not digesting it very well. Okay. Oh, and just to follow up on that, from Evelyn's question, secretory IgA is regulated and controlled by cortisol. In fact, we had a mentorship student years ago who did her PhD on that while she was in my class, which was kind of cool. So we had a lot of discussions about SIG-A during that time because she was getting a PhD in how SIG-A and cortisol relate. That's like something people actually study, believe it or not. But cortisol regulates secretory IgA. So you can see a lot about the adrenals on a GI test. Okay, so now this is a Nutraval. Now we've switched lab companies. Now this is a Genova Nutraval. And we're looking, well, we're going to go to, let's just look at amino acids. There's so much to talk about here, obviously, with this test, but we can start kind of in a grounded way by looking at amino acids. Okay, here's amino acids. These are plasma done from a blood test. And Remember we just said that leucine was a really important one. So we're looking at leucine. Leucine levels are low. Isoleucine, another branch chain, also low. Methionine, which is kind of important for regulating something called methylation, is also low. That's a really bad combination of amino acids to have low. And look at this, see it gets worse. Now, that's not all. Glycine is also low. Glycine is required for collagen production, and of course, all these aminos that I circled there are required for protein synthesis. So if you're missing even one of these amino acids, protein synthesis is not going to go as well as it should, because you need all 20 amino acids to make proteins. There's some, as we talked about, that are extra important, like the branch chains, the isoleucines and leucines of the world. Okay, but all of these amino acids are important. All 20 are important for building muscle tissue. There's 20 of them. There's some amino acids, obviously, on this test. There's more than 20 here. Some of these are not involved in protein synthesis. So now, this is a kind of advanced concept, but if you had, let's say you have someone who's sarcopenic, someone who's losing muscle mass, and you're trying to get them in the gym and you're trying to do this whole program to get them stronger, you could give them the branch chain amino acids plus this magical amount of leucine that seems to make mTOR stimulate so you can build muscle. You could do that. That's assuming what? Is that assuming that with that assumption, what are we assuming their leucine levels are? Think about it. And somebody can type in an answer if you think about it. All the research that's done on those people, did they test their amino acids and only give people leucine who were low in leucine? Absolutely not. So in other words, leucine is used to build amino acids in people who have normal leucine levels usually. If your leucine's low, you're like at a double deficit. You need a certain amount of leucine just to get your levels normal, and then you need another bunch of leucine to stimulate mTOR so you get the muscle growth. You see what I mean? So you can use amino acids in a deficiency state just to get the levels normal, but then if you want to actually build muscle, you need a whole other layer of improvement there. So we're not limiting people that have patients that you want to get their muscles to grow more. It's not just those that are low in leucine that you're going to give the leucine to. You're going to give leucine to everybody, but it stands to reason if they actually have low leucine, they're going to need even more leucine, right? Because the 2.5 grams, that was done on people who had okay leucine levels. We don't really know because they were never tested, but right, you need more than that. So you got to just think through this. You got enough to make up for the deficiency, and then you need another amount of it to make sure that they can build muscle. So, and then just one more thought, and then we'll design a program, and then we'll go to questions. Let's see. What should we do this with? Yeah, let's do it with glycine. Glycine's a good one. That's one of my favorites. So glycine levels are low here. So let's say that you fixed all these other amino acids that are low. Leucine, isoleucine, methionine. You got everything else dialed in here perfectly. And you leave glycine alone, and you're expecting them to build muscle, it's not going to work because you need all 20 amino acids for protein synthesis. One amino acid like glycine being low is going to interfere with protein synthesis. Just a universal problem. Okay. Now, let's do a program design thing here. Here, I pulled up some protocols so you can just see how this would work. So if you were signed up for my longevity class, you would be submitting labs that we would then review, and then we would design programs. And there's a massive curriculum I've built, massive online curriculum, plus live calls where we look at your lab so we can design programs. But for this one, we would do branch chain amino acid powder, say 1 scoop 2 times a day. That's not going to work. You have to add in extra glycine, remember, because they were low in glycine. How much glycine? We had this whole big discussion in about glycine in class the other day. It's actually 3 to 6 grams a day. I know that sounds like a lot, but we just had a case last week where the doctor had put the patient on 6 grams of glycine a day, waited 6 months, and then retested, and they still were low in glycine. So I don't know, it sounds like a lot, but people, if you're testing people regularly, you only do these dosages until you get them sorted out. And then you need the methionine or it's not going to work. Remember, the methionine was low. How much of that? I don't know, around 3,000 a day to really make up for the deficiency state there. And then none of that's going to help if you don't have B complex, because you need the Bs to use all these. And if you see amino acid levels in plasma that are high, that means that they're circulating, the amino acids are circulating in the bloodstream. Unless a person's eating dramatically too much protein, it's most of the time going to mean they don't have enough B vitamins, because we use the Bs to break down amino acids. So most of the time, high plasma amino acid levels indicate low B vitamins. Now, I didn't really go over this in the, well, let me just show you because it's pretty important. All right, here's another quiz question for you guys. So as part of building up muscle tissue, one of the other things that we really want to do is to get more mitochondria built. That's like the holy grail for aging. More and better mitochondria. More and better mitochondria. And so you're getting them all these amino acids. You fix the H. pylori. You fix the giardia. The GI infections are gone now. So now they can absorb. You got them flooded, their system flooded with all these amino acids that they're deficient in. Why are they deficient? Because they had H. pylori and giardia in the first place. So you fix the gut. You got them on the amino acids. You're rebuilding. Now they're in the gym. Now, what was going to be the next thing that's going to limit their ability to not only build mitochondria, but to make them work properly? Does anybody know? Somebody type it in if you know. It's on the page right now. I'm trying to give you guys a hint, okay? It's on the page right now. What would make this whole thing fall apart is a lack of glutathione. Because if you don't have enough glutathione, your body's not going to use those mitochondria. And why is that? Anybody know the answer to that one? What's the number one source of oxidative stress in the human body? Where is it coming from? It's coming from your mitochondria making energy. So your body has these sensing systems and it knows, oh, my glutathione is low. If I really crank up energy production in the mitochondria, I'm going to generate a lot more oxidative stress. And that's going to do what? Kill cells, accelerate aging, because I'm low in glutathione. There's all these sensing systems that can tell that. So you're not going to build muscle. You're not going to really crank out the energy production in a low glutathione state. So you have to get the glutathione working. Then your body's like, oh, I can build mitochondria all day long. And I can put those mitochondria to work making energy, because guess what? All that oxidative stress spewing out of there from all the energy production is going to be quenched and reversed and put to bed by my glutathione. So you got to have that glutathione in place for all these things to take place. It's pretty critical. Otherwise, your body just won't do it. So now let's go back to our program, and then I'll open it up for questions. Isn't this fun? Don't you guys want to do this like for a year? I mean, this is so cool. And I have so massively overbuilt this class. There's so many lectures. I put like everything in there. Everything. It's just insane. So much material. It's really good stuff, though. I've been working on this for a while. Need to get you guys convinced to sign up for it. So you need to have the glutathione. Well, that's maybe too much. Let's say 200 a day. And then up here, we would say the whole treatment program would be clear H. pylori, normalize, can we say that? Normalize amino acid levels, additional support to build muscle, support glutathione, You can do that with glutathione, or you can do it with NAC. It's another option, or you can do both. NAC will boost glutathione, as will glycine. So you have a whole bunch of different options there. And so this would be a longevity, anti-aging, muscle building kind of program where we're kind of touching a little bit on the gut and the adrenals. We didn't do an adrenal protocol, but if their cortisol was high, you want to bring it down, get that fixed. Fix up the gut, get the amino acid levels built out, and then give them all the things they need to actually build muscle. But you got to get the playing field level and get all these body systems working properly before you start to do that final step of building muscle, or as part of it, overall. All right, so now let us take a look. You can scan these codes while I go through questions. I prefer measuring amino acids in serum. That was the way I was trained by Dr. Lord. He's very persnickety about that, but you can do it in urine too. Can do it in urine too. Someone that you can call and talk to about longevity certification. Yes, Kenton, for sure. Just contact the office here. I'll give you the info. And Jennifer is available to talk to you. I am available to talk to you if you're really interested in the class. And just go to the website. Let's see here if I can find my website. And I have all the contact information here. Plus, you guys will be getting emails. You can just email the office too. I guess you don't have to call. Yeah, it's not even worth calling. Just email the office, but the contact info is right here. Or just email back training@kalishinstitute.com and say, hey, I want to talk to somebody about longevity classes. Thank you, Kenton. We hope we get you signed up. Can you exercise in a fasted state or not fasted state? That's a whole complicated area of science that I'm just learning about myself. So depending on what kind of exercise you're doing, there's pre-workout drinks, post-workout drinks using amino acids. There's this whole science of using different amounts of glucose. And then there's depends on the goals too. Like if you want to lose weight, if you're overweight, you're trying to lose weight, there's certain strategies for feeding while exercising or, exercising while fasted. And if you're looking for performance, it can be different. And so a lot of the people that I've followed in this space are performance oriented, meaning that they're working with professional athletes, but the things that they recommend are not necessarily going to be the most effective at actually like a regular 52-year-old trying to lose weight, so that's going to vary quite a bit. Let's see. Another question from Jeff. Yeah, so different backgrounds take these classes for sure. We have nurse practitioners, medical doctors, chiropractors, acupuncturists, RDs. We have some PAs now. We've got like 3 pharmacists that are taking these different courses. I don't know why all of a sudden this is a rush of pharmacists getting interested in functional medicine. But yeah, you can have a varied background and I think still get a lot out of these classes. Let's see, we still have a few minutes. Yeah, I'm going to keep going with questions here. So this is not, oh yeah, so we're going to start the longevity year-long class 4 times a year because there's 4 modules. So you can jump in at any module. And again, the different modules are cardiometabolic, which we just finished, gut-brain, toxins, and hormones and genomics. And you can start at any time. If you want to do the full year, you can start at any time. So there'll be 4 start times every year. There'll be one in the fall. There'll be one right towards the end of the year. And then you can also just take one class and see if you like it or not, and then go on and take others as you want. You can spread it out so you don't have to do it all 4 in a row if that's of more interest to you. And the longevity program is quite a bit different than the mentorship. So the mentorship is designed for treating chronic illness, really, to be honest. For you guys to set up a more traditional functional medicine practice, which is like reversing diabetes. I just had breast cancer. What do I do now? I have chronic fatigue. I have long haul COVID. I have Parkinson's disease. I had cancer, but I recovered. And now what do I do? I have chronic fatigue. My 3-year-old has eczema. My 12-year-old is depressed. That kind of stuff. Like chronic illness, autoimmunity, all that. That's really what the mentorship is for, treating people with problems. The longevity class is that next step. Now you've got all those patients healthy. Now what do? Okay, your depression and eczema are gone. Well, now let's move you over into like really optimizing your health. So that's the distinguishing characteristics. The mentorship is really about how to start a functional medicine practice in the old school version of what that is. And then longevity class is about working with people who are otherwise healthy. And what I want, for all of us really, is as much as possible to have new patients coming in that are looking to stay healthy, that are already healthy. But I recognize it's pretty hard to start a practice from scratch like that. So a lot of people are going to come in and have complex health problems that you have to fix. That's really what the mentorship is. Once people are better, or if you're marketing towards people who are already healthy, then the longevity classes is more appropriate. And we're getting a bunch of mentorship people that are taking longevity because the curriculums or curricula, I forget the plural of curriculum. But anyways, the curriculum in each of the different classes is pretty distinct. Like for example, the GI part of the longevity class is almost exclusively focused on how to regulate and fix the microbiome. There's not a lot on H. pylori in there. That's more mentorship. That's when people are sick. And there's obviously some overlap. And then in the live calls for the longevity class, we're just going to be reviewing labs. So, if you're testing someone who's really screwed up, we're still going to cover it. But if you're going to have a practice that's mostly people who are pretty sick, mentorship is more important. If you're going to focus more on taking your patients who were sick and getting them healthier, or you want to focus on new patients who are really healthy, then the longevity is better. And the way that I see the trend in our industry moving now is more and more and more people every year, I can't tell you how quickly this is happening, are wanting to do functional medicine assessments, but they're not sick yet at all. I'm seeing this in like the 30-something-year-olds now. It's really, it's remarkable and wonderful. 35-year-old, 32-year-old, people that are otherwise perfectly healthy. They're surfing, they're playing golf, they're doing whatever they're doing with their lives. They just want to stay that way. No health problems. They just want to check. That's, in my mind, your ideal longevity patient. Okay. All right, let's see here. I think we're out of time. We are. I think if I missed any questions. Oh, herbal treatment for H. pylori. We did a study with the Mayo Clinic on this, didn't we? Yeah, and we 8 out of 9 of the H. pylori cases we reversed with the herbal program. So you can definitely do it, but you have to be pretty aggressive on the herbs. Let's see. I think I got most of these covered here. I'm sorry we have to end up now, but I hope to see some of you in class. Scan these QR codes if you want to get a discount, either on the individual course or on the year-long certification. This is the year-long certification QR code here. And then you'll be getting these in your email inbox. And please, Kenton and others of you that asked, reach out so we can chat about the class. It's not too late to sign up for this one. And if you're more interested in the fall, then we'll have another one starting then as well on a different subject, right? You can jump into this cycle of 4 classes at any of these 4 different points. Take care, everyone. We'll talk soon. Bye now.